Hello everyone, I'm Dr. Amelia. I'd like to introduce Dr. Raghavendra Ramanujulu. He's the lead consultant for pain and palliative care. Sir has completed his neuroanesthesia. He's then gone on to do interventional pain, chronic pain, and then palliation. So his vast experience is very important for the conversation that we're going to have today. I just wanted to talk to you about a topic that a lot of people out there are looking for in Google, mostly chronic pain. I think there is lack of understanding of what chronic pain is. So would you be able to tell us just in a few words what it is, please?
I'll try to make the answers very simple as possible for a layman. So what is chronic pain? Pain which is persisting beyond any tissue injury from the recovery mode of point. Now, what does that mean in the layman? Any pain which is there for more than 3 months, which is not becoming better despite getting the best of the treatments, could be the specific super specialty you would have seen, as well as done multiple investigations, undergone physiotherapy, rehabilitation and others, but still the pain is lingering. And this could be even after a surgery, or it could be proposed that the surgery is required, but you're not fit enough to undergo surgery. All these gamut comprises of chronic pain. So this is what a patient would actually be looking forward to understand this is as a chronic pain management program would help him at.
So my next question, or what we are trying to get to people to understand, pain management is a very new specialty. So there's a lot of confusion as to where do I go and when do I approach a pain specialist. So what would you advise the public as to what pain clinics are and when to approach a pain specialist?
So as I mentioned, what is a chronic pain already is. Now, whoever have got pain for more than 3 months, they've tried everything possible and still the pain is not becoming better despite all forms of management. That is where they come and see a pain clinic to meet the pain physician or the group of people who would be there in a pain clinic.
So who are these people and why is it important to have a group?
Most of them think a pain specialist is a person who's just doing physiotherapy or some therapy, or is he a doctor itself is a question most of them might have, because as you really mentioned, it is a new super specialty which has actually emerged, and it is something which has actually made a lot of changes and a lot of strides which have actually come up so that it's grown by the mile. Now, a patient who actually has got chronic pain, it's just not a physical aspect. It does not affect only his body. Once this chronic pain is more than 6 months, it starts affecting his psychology. He might get too anxious, or he or she might get too anxious or feeling depressed, saying that I have done everything possible. I've gone to all the doctors, I've gone to other people, I've done all the therapies which they have told, I've taken medications, I've done surgery also, but despite I'm having pain. So that is going to affect. So mental concerns, mental issues is what we call about psychological concerns are a part of this chronic pain group. Not only that, we're talking about the psychology aspect. Then once they actually get anxious or depressed, they start actually isolating themselves. They don't socialize, they don't go about. Like now take for example, severe neck pain or back pain. If I have to go to a function, if somebody see me limping, then they will ask me what it is. I've already been telling them multiple times. Or if I have a headache and this is becoming really bad, I will not be able to actively participate in that social function. So why me? I should not be going there. So therefore, this becomes not only a physical, psychological, social aspect. So therefore, it needs a full team to take care of this. So it's just not a pain physician, as you rightly put across. A doctor is not enough. A psychologist, probably if the depression or anxiety is too high, then a psychiatrist might be required, a physiotherapist, or occupational therapist, speech and deglutition. It could be post-trauma, post-stroke and others which have chronic pains. So therefore, you need to have a rehabilitation specialist. You need to have dietitian. You need to have other people who might be required for that individual, that perspective. At Aster CMI, we do have the entire gamut, the entire group which looks after all these aspects. So what is most important over here is the right kind of diagnosis, and then individualize that plan for management. So it comprises a full interdisciplinary team at Aster CMI.
So you talked about chronic pain. You mentioned 3 different types of chronic pain actually when we're talking about interdisciplinary. Something that very commonly affects people: headache, shoulder pain, backache, leg pain, things where you cannot see outside, but it traumatizes an individual. Headache seems to be the most common. Probably there are many precipitating factors for this. But everything cannot be one kind of headache, correct, sir? So could you just tell us the different kinds of headache? The commonest is migraine, but not everybody has migraine. So what else can it be?
If we divide into different types of headaches, now what is acute? What is less than 3 months? Could be sinusitis, could be a traumatic injury, could be fractures. These are all very, very specific acute injuries. Those are pains which is there less than 3 months. So when it comes to chronic, which is there more than 3 months, we're talking about patients who've got pain because of sinister things like aneurysm in the brain, where it is going to rupture and things like that. This is very, very bad. This needs to be looked after by the neurology and the neurosurgical or interventional radiology, which is there in Aster CMI. Now, if you have been cleared by all the neurological group and then you have pain, could be diagnosed as migraine, which is the commonest which people see, or we could actually have tension headache, which is much, much more common compared to your migraines. The next thing is neck pains leading to headache. That's called as cervicogenic headaches. Small joints in the neck which get strained. Post-COVID, what has happened is people have hooked on to their tablets or phones. So they look constantly staring into it with bent neck. So therefore, the strain on the neck actually is very, very high. Or IT professionals or people who have desk-bound job will all have this kind of concerns and issues. So you're talking about cervicogenic headache, which could be a concern. Or you could have some problems within the spinal cord itself. Small discs, which is there into the nerve, which is being pressing on the nerve, which is called as a slip disc. People would have heard of slip disc in the back. But in the neck also, do we have? Yes, we have discs in the neck also. That also could cause pinched nerves. They also could actually bring about neck pain and headaches. Now, to actually summarize, it could be acute, wherein you have a stroke kind of a pain, which is going to be vascular, which has to be cleared by the neurosurgical people. It could have been sinusitis, usually goes to an ENT. Whereas it is in chronic, we're talking about, which is the migraine, which is the commonest heard. But commoner than migraine is tension headache. Now, tension headache is what is muscle related. Now, you don't sleep properly. Your mood is not okay. You're too stressed. That itself can lead to a lot of muscle pain and headaches. Or neck pain, as I told about, looked on to your laptops and computers, also could lead cervicogenic headaches. This is in a nutshell. If you want further understanding, you'll have to come to Aster CMI, individualize that plan, and take it ahead after a perfect diagnosis.
So most people would think that, doctors don't spend much time. That is the most common thing. The other thing is there are multiple investigations that people do. Now, when you come to a headache, it is a very fearful thing. What test are they going to ask me? What investigations are going to be asked for? How do you go about actually asking for an investigation? And is it necessary to have important investigations done?
As I mentioned, there are different types of headaches.
Correct.
After we go through a thorough history, and you mentioned a rightful point, people spend less time with a patient. Now, in Aster CMI, Department of Pain and Palliation, we take a detailed history, then examine the patient, understand what their concerns are, how they're actually coping with it, what's making them to get this pain worse, or what is reducing them. Based upon these symptoms and signs, we would be able to at least come to a working diagnosis. Based upon that working diagnosis, we might actually specifically target which kind of investigation is required. Most of them who come to a chronic pain clinic would not have any of the acute issues like sinusitis or vascular headaches, which are very, very sinister. Now, chronic ones, migraine might not have any investigations which could be there. Now, cervicogenic headaches, probably an X-ray of the neck or the spine to be more specific, or MRI to be much, much more specific. Now, these are certain things which can be looked into. Or if it is just tension headache, you will come to know by the history itself that the patient is having pain, which is having a definitive pattern of the tension headache. Now, you could have neck concerns starting from here going up. On an examination itself, the muscle itself will be able to show you. Now, if it's a cluster headache, usually they would have gone to the ER multiple times. They would have seen the neurologist. They would have tried all of it. And they would actually be specifically referred from a neurologist to do specific interventions itself. So that is where we could actually be.
Interventions also, I think it's very important. You've emphasized it throughout your talk that it's very individualized. The minute they come to a pain clinic, a chronic pain clinic, it's not that the first thing we do is take out a needle and do an intervention. It's important to understand the patient, but the interventions also become an important part. So what kind of interventions are offered at Aster CMI Hospital for headaches or whatever you...
Absolutely an important question. Most of them are confused. Intervention means always they think is all about a needle and needle being there.
Correct.
Now, as I mentioned, chronic pain is just not about physical concept, psychological concept as well as social concept. Now, if you have to actually improve from physical aspect, a needle intervention is required. If they've gone through all the conservative management or surgery they are not apt for, then we're talking about that. But if it's psychology, you need psychological interventions, you need psychiatry interventions. Those are all interventions only. From the social context, how the person is rehabilitated, how is he going back to his work, how is he functioning, that is a bigger intervention. So intervention is specific, and that kind of interdisciplinary teamwork is there available in Aster CMI. So based upon that, each aspect could be tailor made and that domain specifically answered. From the physical concept, if a headache is required, facet blocks could be done. Cervical concerns are there, you could do cervical epidurals. Headache, migraine could be there. Now, stellate ganglion blocks are one group of them, or spinopalatine ganglion blocks in cluster headaches, intractable cluster headaches could be actually offered for. These are all daycare procedures and they don't actually require a longer term admissions. Probably admission in daycare for about 3 hours for the entire duration for the procedure as well as post-procedure recovery is 3 hours only. And from the perspective of CMI, what specialty it is, we use advanced biplanar cath labs to actually have a precision in doing these interventions. Or you have ultrasound guided ones, which are the best of the ultrasounds which we have in our own department, which could actually be the best in terms of technology wise supporting these interventions. So if you ask me what is better offered at Aster CMI is a comprehensive way of looking at it. It's just not a needle intervention, which another place could offer, but comprehensiveness, this kind of group of specialists coming together in a pain clinic, which could be offered to a patient, is very, very sparse.
Once the intervention is done, it's very important follow-up wise. So what is it that you advise for patients who have chronic pain? Many people think I'll get an injection and that's done. So what would you advise patients who are suffering from this and if they're listening to it right now?
So the perspective is patient-related outcomes are very, very important for us. And how the patient is actually were there before and how they're coping and improving themselves is what is important. Have they gone back to work? Have they been rehabilitated to do whatever they want to do? Is what a 76-year-old wants to go to the garden, do some gardening, do some cooking and aspects of praying and things, their routine activity. Whereas a 35-year-old would be required to go to the work, fetch whatever has to be done for their household choruses as well as look after their children. So this is an individualized plan. Now, once we look at it, where they were and how they are improving, that is what is important. So patient-related outcomes are what is important and we go by those measures rather than just by decrease in pain scores. So what I'm talking about is a comprehensive overall improvement rather than just a pain improvement. That is what is the speciality of having an interdisciplinary team at Aster CMI.
Understanding them as a person, as a whole person.
Absolutely.